Welcome to Fireside Chat, and as usual, there's no fireplace here either, but we have changed the venue and we've made it a little bit more interesting by being outdoors with some great flowers behind me, so hopefully you'll enjoy this venue. We've got lots of things to cover today. George Counts will talk a little bit about some of the risks associated with COVID. We want to keep reminding people of the risks so that we can help each resident make good judgments about their choices in behaviors and practices. Christy Seymour will give an update on financials. We touched a little bit about that on our small group sessions, but we'll also cover a little bit more today. There'll be some new staff updates from Brenda, clinic news from Eve Nyman, philanthropy updates from Herb and Doris, and the resident council updates from Peter Shapiro. And then I'll circle back around and cover some announcements. So I hope you enjoy the Fireside Chat today, and let's get started.
Good afternoon. I'm George Counts, head of the Horizon House Health Advisory Group, and I want to say a few words about the risk of coronavirus. Concerning the status here in Seattle, Greater King County, we had a peak number of infections in late March, early April. The number dropped to a low in late May and early June, but from then until now has gradually risen until we are almost back at the peak we had at the beginning. So there is a lot of coronavirus, an increasing amount, circulating in the Seattle King County community. A lot is known about this virus. We know how it spread. We know that it spread either by airborne or droplet nuclei. We know that it spread from persons who are in the early stages of the infection, so-called pre-symptomatic. And we know that a substantial portion of cases are acquired from folks who are asymptomatic. We know what the risk categories are. Elderly folks like us with chronic underlying disease are at highest risk of getting sick and dying from COVID-19. We also know how to prevent it. Face coverings properly worn, social distancing, and hand sanitation. So the history of coronavirus, COVID-19 here at Horizon House began on March 28th, when we then had cases among staff and residents, including some deaths among residents. But we have had no cases among independent living residents since April. So we are confident that we do not have coronavirus circulating among residents here at Horizon House. We have had a couple of cases of positive tests among staff and contract workers, but we're confident about the residents in independent living. Because of that, we've been able to have a gradual, phased relaxing of our guidelines governing our activities here at Horizon House. These have been based on scientific information, local, state, and federal guidelines, and our own best interests and our own best judgment. So how will coronavirus return to Horizon House? There are two ways seem likely. Someone who comes and goes from the greater Seattle King County community will pick up the virus in the community and bring it into Horizon House, where it can then spread to the residents. This is the reason that we have not allowed any visitors since back in March. A second possibility, however, is that residents here who leave and go out and interact with the Seattle King County greater community where there is increasing coronavirus activity, pick up the virus in the community and bring it back into Horizon House. So the take-home message from my talk is this: residents who leave for any reason and interact with the greater community, in return, there is some risk for them bringing coronavirus into the community. This risk cannot be eliminated, but it certainly can be minimized. Let me give you an example of how this might work, how we are asking you to make this work. If you make a plan to leave Horizon House for any purpose, for any activity, from going for doctors and dental appointments, going for a long walk, walking down to the Pike Place Market to pick up flowers, or going grocery shopping. These are all activities which I know are happening. We're asking you to think about, in that activity, will I be able to maintain those activities that put me at low risk for picking up the virus? And if you think about that, then decide, is that a risk I'm willing to take? Let me give you a very personal example. I'm 80 plus years old. I have chronic lung disease. And I believe that if I were to get COVID, there's a good chance that I could be seriously ill or die. But I have 2 sons in the area. And if I decide I want to visit my sons, I need to think about, will I have a chance to maintain my distances in my visit with them? Will there be food or drink so that I'll take my mask off? Have they participated in high-risk activities such as crowd gatherings or parties within the past 2 weeks? All of those things I would think about before I make a decision. Is this a risk I'm willing to take? I could decide that it is, or I could decide that it was not. So we have had questions from other residents about our infection prevention measures. Since we believe that we have no circulating coronavirus in the community among our independent living residents, why not simply go back to the way that we had it before? Is there any scientific justification for why we decide to allow 2 visitors in an apartment rather than 4? No, there is no scientific justification, but there is a very important symbolic justification. And that is, we are in the midst of a pandemic. In our community, cases are rising. We are in a new world order. Things will change. We will never, I say never, it is unlikely that we will go back to the way things were before. And it's important for us to remember that and to remind ourselves this is a new normal. We need to be vigilant to protect ourselves and our loved ones and our friends and colleagues here at Horizon House. So that's my message. Please contact us either as a member of the task force or my health advisory group colleagues, Drs. Abe Bergman, Finley Wallace, Jeff Graham, or Margaret Burke. Thank you very much.
Good morning. It's been 3 months since I was last here to give you a financial update. This quarter has been one for the history books. This is the first quarter where we've had 3 full months of the pandemic, and we were not sure how Horizon House was going to fare financially. So far, we've been able to control our costs, even though our revenues are down about 4%. That 4% equates to about $550,000. One of the key drivers of revenue is occupancy. When the no visitor policy went into effect in March, we could no longer do our one-on-one personal marketing tours. Our marketing team had to reinvent their marketing strategies. They developed the virtual tours for our apartments as well as for Horizon House. You may have seen some of those on YouTube. And they've made some great progress. We only had 1 resident move in the second quarter. They have now sold 10 apartments, and we are getting ready to have another 6 to 8 apartments remodeled, and they'll be available to sell shortly. Occupancy in independent living declined slightly for the quarter. We're at 98.6% compared to a budget of 98%. Total revenue is below budget by $97,000, which is about 1.5% of total occupancy revenue. One of the reasons independent living occupancy is declining is because we've had several transitions into supported living. Occupancy in supported living has been increasing over the last few months. Year to date, occupancy in supported living is 88% compared to a budget of 98%. So this is significantly below budget. However, we are starting to see SL occupancy increase as we were down to 82% last April. Total revenue in supported living is under budget by $108,000 or 2.5% of budget. Dining services has taken a hit in the second quarter as well with the takeout only model. During the past 3 months, dining services is operating at about 2/3 of its normal revenue levels. Year-to-date dining services revenue is about 18% under budget. Several of you have reached out recently regarding choice dining, and we understand that those choice dining balances are growing. And I think Mike mentioned earlier that we are working on reviewing the possible changes to that program, and we will communicate any changes to you as soon as we have them. As for other service revenue, including the garage, the salon, housekeeping, we are losing about $60,000 a month from these services for the quarter. Without being able to open up more of these services, we anticipate that this loss, $60,000 or so each month for the remainder of the year. With the shortfall in revenue, we have been able to control our expenses. Overall expenses are 6% below budget or $720,000. 2/3 of that relates to supported living. Supported living has significant savings in labor, and that is because they do a very good job of matching their labor expenses to the care level and the occupancy in supported living. They are seeing almost a 6% savings, and that is about $243,000. Similarly, in dining services, we have labor savings as the staffing model there has changed with the takeout only, does not require as much staff as the tableside service model does. We also have significant savings in the food service costs with limited menu options. Dining service expenses are about 8% below budget or $122,000. I want to point out that Horizon House has not had any layoffs or furloughs during this whole pandemic. We've had some staff attrition, and we've held off on replacing some of those positions until we truly understand what the needs will be for staffing going forward as this pandemic has changed the way we operate. You may recall that we implemented Compassion Pay last April, and we were very intent on having this go through June. We recognize that staff are very disappointed that this has ended. If you think back to where we were in April, it was implemented under a time where we were at a stay-at-home order, and staff were very fearful about coming to work. And we needed our essential and critical staff to show up to care for our most vulnerable population, those in supported living, as well as to help with the other services that we needed to provide to residents, including package delivery, mail delivery, newspapers, meal deliveries, all of those things. We're working with staff. We're continuing to have dialogue with management and with staff to understand what the local Compassion Pay will mean in the future. I'm not sure if any of you are experiencing this, but personally at home, my expenses are my monthly bills and my grocery bill. There's no other money going out the door. I have nothing else to spend. There's no entertainment, very little restaurants. And so I think Horizon House has experienced a very similar situation. We're seeing some additional expenses such as Compassion Pay, but we are also experiencing some lower expenses because we are not spending the money that we had budgeted. We are under budget, again, 6% in expenses. You may recall the CARES Act that was implemented back in March from the federal government, a stimulus package. Horizon House took advantage of a payroll protection loan. We had our banker call us up one day, very excited about this program and encouraged us to apply, which we did, and we received the loan within a number of weeks. The purpose of the loan was to help businesses such as Horizon House keep their employees employed, and we intend to use those funds in that way, keeping our staffing and keeping our staff safe in the work environment. We have used those funds for the Compassion Pay as well as other additional expenses such as PPE, gloves, masks, disinfectants, temporary labor, such as what we needed at the screening stations in the lobby. Back to our second quarter finances, we ended up with a 9% net operating margin for the quarter. That is the percentage of revenue that we keep after all of our expenses are recorded. And when we look back to the first quarter in March, we had a 13% net operating margin. So while 9% is still really good, and we aim for a 10%, we lost 4 percentage points over the quarter. And we may anticipate that this continues throughout the next quarter and potentially throughout the year. So while we are still in good shape right now, we do anticipate that by the end of the year, we will maybe break even or end up with just a few percentage points of net operating margin. We will continue to manage our costs and operate our revenues where we can, such as maintaining our occupancy, until we are able to open up more services. I will continue to provide you updates quarterly, and until then, stay safe.
We are very excited to introduce to you today the 4 new hires that joined our organization in the month of July. We've had Knock join us as a diet aide. Mindy Erickson joined us as a temporary HR business partner. Randy Valdez has joined us as an EVS technician. And Kevin Wall has joined us at the front desk as a front desk associate. We're very excited to have each of these members join our Horizon House team. And when you see them, say hi. Thank you.
Good morning. My name's Eve, and for those of you who don't know me, I am the clinic nurse here at Horizon House, and I'm here this morning to talk to you about a couple of topics. The first one is dehydration, and that's a big topic at this time of year in particular, because a lot of us do not drink enough fluids to keep us well hydrated. People say to me all the time when I ask them, how is your fluid intake? They say, oh, fine. And maybe they have a cup of coffee in the morning for breakfast and a little bit of juice at some point in the day, and they think that's enough. And it isn't. So I've brought this handy little glass, which I think is about 8 ounces here. And you're supposed to have 6 to 8 of these a day. Isn't that amazing? So most people are not drinking that much. So I want to encourage you to increase your fluid intake for many reasons. One, it helps to balance your blood pressure, and it keeps your bowels regular, and we all want that, don't we? What I advise you to do, and what I do, is I have a container that holds the amount of water I want to drink in a day, and I fill it up in the morning, and then I need to have drunk it before I go to bed. So the earlier the better for most of us. So get your fluids in and feel better. And actually, all year round, it's a wonderful thing to keep up with your fluids. So that's the first topic. The second topic is the screening assessment for when you are out of the facility for more than 24 hours. So there's been a lot of misunderstanding around this, so I'm going to explain it clearly, and hopefully it will make sense to you. If you have any questions about it, please feel free to call us in the clinic or come down and see us and ask us for clarification. So here we go. If you are out of the facility for more than 24 hours for any reason, that could be that you're in the hospital, or you went on a little vacation, or you went to see your family, whatever it is, when you come back and you come through, they will ask you at the front desk, have you been away for more than 24 hours overnight? And you'll say yes, and they will say, please go to your apartment and quarantine until the clinic can call you. We don't want you coming down to the clinic to check in. We want you to wait in your apartment, and we will call you, or you can call us the next time that we're available or open. So if you come back on a weekend, we are not open. We are open Monday through Friday only. So we advise people to come back during the week when we are here, or know in advance that if you come back during the weekend, you're going to have to stay put in your apartment. That means no going out and about in the community until we can talk to you the next business day. So what happens when we call you or you call us? We will say, these are the questions we're going to ask you. How long have you been gone? Where have you been? Who have you been with? Have you had any contact with anybody who has been diagnosed with COVID? Then we decide, according to your responses, whether you're going to go on the low risk, which would mean you're allowed out back in the community without quarantine, or if you're high risk, which would mean you would be quarantining for 14 days on the day after, 14 days from when you came back to the facility. So you're probably thinking, well, what kind of answers put me in the high risk? That would be if you have been on an airplane. I don't care whether you travel first class and you wear a hazmat suit. If you've been on an airplane, you will be in the high risk and you will be asked to be quarantined. So there's no argument there. If you've been around relatives who are out in the community, grandchildren, children, you're probably going to go into the high risk category. And I think that it helps to be forewarned so that it doesn't come back to you as a shock when you come in and someone says, I'd like you to quarantine for 14 days. So when I have said that to people, it is hard to swallow. But I'm hoping that if you know before you go, you can get yourself ready for that response. So again, airplanes, contact with other people, high risk. Say you've got a retreat home or a second home or an Airbnb that you went to for any length of time and you didn't see anybody and you weren't out there shopping, then that's fine, you're a low risk. A lot of people just go to a second home, don't see anyone, have a lovely time, and then just come back, and then they don't have to be quarantined. The people who decide our policy are the task force, and they meet every day, Monday through Friday in the mornings, and they discuss the quarantines and everything to do with COVID. And there are representatives from the community on that committee. So they are the ones who decide what policies we're going to follow to protect the community. And we all know that this is difficult to swallow. Some of the decisions are hard, and some of them, to some of us, don't always make sense, but they are working to keep our community safe. So as frustrating and sometimes painful as they may be, we are asking you to go along with them because we want to stay well, and we've done remarkably well given what we're up against. And just know that we know that sometimes it's very difficult. So thank you so much, and please feel free to come see us if you have any concerns. Okay, thank you. Bye.
Good morning. It was delightful to see you all at the ice cream social when over 400 bars of ice cream were delivered by 7 teams to the apartments at Horizon House. We had such a good time visiting with all of you, and I hope you enjoyed the ice cream social as much as we did. And in the last 2 weeks, since July 13th, yes, the last 2 weeks, we have received from residents over $3,200 in contributions. And of course, that more than helped us to be successful with the $2,000 grant. It was actually a challenge match that anonymous donor gave. So again, thank you all so much for your contributions, not only during this particular period, but throughout the year. Thanks so much.
Welcome, friends. As Doris has said, I'm going to talk about money. First, the good news. If you look at the thermometer on the right, you will notice that we have met our endowment goal. Now you may ask, what's important about that? Well, the importance is that 4% of the endowment is used every year for residents' assistance. Our contributions make up the difference. between what comes from the endowment and what residents need. And that's between $900,000 and $1 million a year. Now, if you look down at the bottom of that thermometer, 69% of the residents have given to Partners in Caring this year. Typically, 84 to 85% of the residents will give to the Residents Assistance Program. I don't know what's happened this year. I suspect it has partly to do with the virus and what the virus has meant in our lives. Most of us, I think, feel somehow or other there's a kind of loss of intimacy, a loss of togetherness, a loss of responsiveness from those around us that we have known in the past and are missing today. But we can't let that concentration on what we have lost cause us to forget the people who may have greater need than we do. So what I'm asking you is to think seriously about what you can give. If you have given, give more. If you haven't given, give everything that you can. Don't let the virus win. Think about your neighbor's need. Give generously if you haven't given as yet. We need each other more than we ever have needed it. Give generously.
Greetings, I'm Peter Shapiro with news from the Residents Council. I'm going to be talking about two dates. They may not seem significant to you at first, but I'll give you some hints. They'll appear magically on the screen before you know it. The first date is, okay, that's good. There we go. So there it is, February 18, 2020. So what's so special about that? I'll give you some hints. It was a Tuesday. It was the third Tuesday of February. It was at 2 p.m. It took place in Anderson Hall. You got it. It was the last time we were able to gather for a monthly meeting of the Residents Council. You know what happened next? You may not be able to read this, but I'll read it for you. In March, all events canceled until further notice. And there we were. Sometimes quarantined directly into our apartments, certainly exercising social distancing when we were able to leave our apartments. So, humans, of course, are social creatures. You don't have to be an anthropologist to know that, or a sociologist. Technology quickly expanded to fill the vacuum, fill the need. There'll be families, the grandkids probably, would introduce the family to Zoom technology. They'd have meetings by Zoom. Church groups, social clubs, reading groups. My first exposure to Zoom technology was attending meetings of a nonprofit organization off campus by Zoom. So the Residents Council started an initiative with tremendous cooperation from the Horizon House management. The initiative was to be able to continue having resident council meetings, resident council planning meetings, resident council committee meetings where committees could plan events, could discuss what needs to be done, and could actually present programs using the Zoom technology. Where Horizon House management came in is they, of course, needed that technology for their own management purposes, and they agreed to grant us 6 sublicenses for the resident council use to support the meetings of the various committees and to present programs. Residents Council also ponied in for a couple of licenses. So we had a team of people who were learning with the phenomenal help of the Horizon House IT department, how to use this technique, and they began to work. They began to meet, committees began to meet, they began to plan. The result is, by now, we are presenting about as many programs as we did before COVID came in to disrupt things for us. I did a random sample of that, random meaning those particular alerts that I didn't happen to throw into the recycle bin. And the random sample showed that there was about a dozen a week of these events before and also now taking place. So here is the second date, August 18, 2020. I think you probably know where I'm heading. That is also a third Tuesday. It's also a time that will be occurring at 2 o'clock in the afternoon, and it's going to be our first resident council monthly meeting since COVID came to visit us. Now, of course, we're not going to be able to be in Anderson Hall. Not yet, maybe not for a long time. The management and we at Residence Council are planning, not expecting, not predicting, certainly not hoping that conditions will continue like this up through 2020 when 2021, we need to be ready to deal with this continuing situation and taking appropriate steps in planning. Earlier this month, we had 3 election forums brought using the Horizon House webinar technology. And we received a lot of very good comments about seeing the candidates up close as opposed to from a distance in Anderson Hall. The content and presentation of the candidates was good. We had a learning curve. We overcame problems, and now we're ready to move on with that same technology for our monthly meeting in August and thereafter via a webinar technology. Now here comes a somewhat wonky part, and so I'll forgive you if you doze off, don't worry. The way it works is that we have the software, the Zoom software, it's called webinar software, and we start a meeting. The event of that meeting is then zoomed up to YouTube. Horizon House has a section of YouTube dedicated to its use, not to the general public. And so the meeting that's preceding the forums that took place earlier this month and the August meeting goes first up to YouTube, the Horizon House section of YouTube. Then the software that runs HHTV, to use a technical term, grabs, that's the term, grabs that transmission from YouTube and brings it down and displays it on the screen. So there are 3 ways that an audience member can observe what's going on. They can join the webinar directly as a guest or an audience. They can watch directly and at their leisure on YouTube, or they can watch on the day of the meeting. They can watch on their TV at home or at later broadcasts that might take place. I mentioned this transmission series and what's involved to point out one thing that's a great advantage, if you wish to do it, of joining the webinar directly. And that is, there is a function for people who are attending the webinar as audience and guests to ask a question. And hopefully we'll be able to spot the question and be able to deal with it right then and there, or if not then and there, later after the meeting. So when it comes to mid-August, there'll be notices, of course, in the alert, including notices that are electronic and can be found on the HH Connect website. People who sign up with the communications team, Laura Tuft and her gang, can have the alert in electronic form sent directly to them. And the advantage of that is that the alert will carry information which will tell you how to join the webinar as an audience member, or how to go directly up to YouTube. Again, if you want to be having a possible opportunity to ask questions and receive answers during the course of the monthly meeting, you should try to get to the webinar directly, and hopefully we'll be able to answer your questions right then and there. We are so grateful for the support. We, the Residence Council, are so grateful for the support of the wonderful IT team, Brian Levitt, Devin Rosner, and our program and support manager, Risa Ransom. They've been working with us. They've been gracious. They've been helpful. They've been putting the time in, and we could not have done it without them. Now, if you're watching this on Friday at the usual Fireside Chat time, we're now recording the Tuesday before. On that 1 o'clock slot after the Fireside Chat, 11 to 12, the 1 o'clock slot will carry Black America since Martin Luther King. The first 2 episodes of a personal journey brought to us by Professor Henry Louis Gates Jr. and being presented in remembrance of United States Representative John Lewis. I hope you'll be able to watch that and have a good day. Thank you.
Okay, and now for some CEO updates and announcements. I always want to take out time to thank everyone for being so good about following our recommendations and requirements for behaving during this pandemic that we're experiencing. You know, it's always up to the residents how we're able to manage ourselves so that we all stay safe. I think Horizon House has done a pretty good job. Our biggest fear is how you might be interacting and how our staff might be interacting when we're outside of Horizon House. So hopefully some of the comments and the thoughts today will help you make better judgments about what you feel safe to do and what might not be so safe to do. A couple of other things to announce is that we are going to start to try to make some exceptions in some of our rules. We recognize that people have to have a normal life, and it's hard to get back to normalcy, but we know that people have to make their appointments for their accountants and their lawyers and their medical appointments and other important things to take care of day-to-day life. And we want to make sure that we can accommodate those with exceptions so that you're able to conduct those more freely. So we will do those on a case-by-case basis. And if you have questions, you're welcome to talk with me or with Christy or with Lori, and we'll help make sure that we can make some of these things happen for you to get things done. I also want to make sure that everyone remembers, take your key with you when you leave Horizon House. It makes it a little bit easier on the front staff when things get busy and they may not see you at the front desk to let you in. So when you're outside of Horizon House, have your key so that you can get in for easy access. Another update is that we're really thinking through the value of our meal program. A number of people have experienced the pressure of the buildup of our choice dining dollars, and we recognize you can't spend those dollars in quite the same way you used to when the dining room was open and the bistro was open. So we are revisiting in our budget for 2021 the choice dining fee and the rollover of those fees as they add up when you don't use them. We want to make sure that everybody feels that there's value in what we provide, so we're giving that careful thought, and we will be talking in more detail about that once we get the budget numbers worked out. But our goal is to make sure you feel like you're getting value, and we know that takeout is not quite the same value as being able to eat in the dining room or in the bistro. We're also going to try to offer more offerings as a grab and go in the bistro so that people can come down and grab something in a safe way and take it out and eat it in their own residence, just to kind of break it up a little bit so everything isn't on a delivery basis. Master planning updates. You've all seen a few of our improvements. We've put new carpet in the main lobby and also down around the Fireside Lounge. And you can see that there's a construction barrier up there, and those improvements are being made as we speak. The library, of course, has been closed and will be until we finish the Fireside Lounge, mostly because there's a lot of work in the ceiling and in the lighting that will take place, and we don't want that to be interrupted by use of the library. People do have additional spaces now to congregate a little bit on a safe way, down on B1 in the Parkview Terrace, and also in the social room. Again, we don't want to have large congregations of people, but when 6 people are together and they are properly distanced and wearing a mask, we feel that's a safe way to be. Another announcement is that we've got an exciting thing coming up here, Reflections on the Changes in Seattle. And it's a panel discussion that will be on HHTV on Tuesday, August 4th at 3:30. It's sponsored by our Board of Trustees and will have some of their participation, along with the sponsor of the Community Relations and Diversity Committee, and participation by those members as well. The guest speaker is going to be Norm Rice, former mayor of Seattle, and a number of other guests will also be included in this presentation. It will be available for all of you to watch on HHTV, and hopefully you're all going to look forward to seeing that. Another bright spot, I think, is the Zoom meetings we had for our small group session. We've all come to appreciate how valuable the small group sessions are in a way in which to communicate with one another, to ask questions, and to be able to kind of be in community to address issues and things around Horizon House. Obviously, we haven't been able to do that in person in the way that we'd like to, but we did do it on video and on Zoom, and we had 61 residents participating in our 4 sessions. So hopefully that went a ways towards improving our communication process. It seemed to go well. People seemed to appreciate it. There was a good dialogue and exchange on topics. So hopefully you'll have a chance to watch that. And the next time we do it, the next quarter, you'll have a chance to participate as well. Now, the Library Book Exchange they've thought of a creative way, the Library Committee, to deal with the closed library. So we've got a book exchange that happens Tuesdays and Thursdays from 9 to 11 in the forum. That's a great way to keep the library going, even though it's not the regular library space, but it's a way in which we can still keep everybody finding the books they want and reading what they want to read. The 4th of July celebration was also a big event we had recently. Wasn't exactly how we did it in the past, but it was a virtual celebration that brought a great committee, the 4th of July committee together of residents, and then the dining committee or the dining team together to put on a great meal. And hopefully that's something that was, while unusual, maybe a little bit different, was fun and enjoyable for everyone. So hopefully that notwithstanding the limitations we have in this crazy pandemic environment we're in, everyone's feeling like we are making some progress in efforts to try to normalize things and also to try to have a little bit of fun amidst the other, more difficult things of rules and regulations about how we behave and act. Thank you again for watching, and I hope that we'll see you next time when we have this in August, and that will be on August 28th at 10 a.m. Thanks so much. We'll see you soon. Bye now.